Hey everyone, welcome back to Azeem USA, your go-to source for breaking health news that matters. I'm Azeem, and today we're diving into something absolutely terrifying that's happening right now in America. Before we jump into this nightmare scenario, smash that like button, hit subscribe, and ring that notification bell because this information could literally save your life. Guys, I need you to sit down for this one. The CDC just dropped a bombshell report that has medical professionals across the country absolutely terrified. We're talking about something called nightmare bacteria. And no, that's not some Hollywood movie title. This is real, it's happening now, and it's spreading faster than anyone anticipated. Here are the bone-chilling facts. Between 2019 and 2023, infection rates from drug-resistant nightmare bacteria rose almost 70%. But here's where it gets absolutely insane. Cases involving something called the NDM gene skyrocketed by 460%. That's not a typo, folks. We're talking about a 5-fold carbapenem-resistant bacterial infections in 29 states in 2023 alone. And get this, 1,831 of those cases were the NDM variety, the absolute worst kind. So what exactly are these nightmare bacteria? Let me break it down for you in simple terms. These are superbugs, bacteria that have evolved to resist our most powerful antibiotics. We're talking about germs that laugh in the face of drugs that used to be our medical superheroes. The star villain in this horror story is the NDM gene. That stands for New Delhi Metallobeta-lactamase. This genetic code turns ordinary bacteria into antibiotic-destroying machines. Dr. David Weiss from Emory University called the rise of NDMs in the US a grave danger and very worrisome. Here's what makes this absolutely terrifying. Only 2 antibiotics work against these infections. Just 2. And they're expensive, toxic, and must be given through an IV. We're literally running out of weapons in our fight against these microscopic monsters. Now you might be thinking, Azeem, this sounds like a hospital problem, not my problem. Wrong. This affects every single one of us, and here's why. Dr. Maroya Walters, one of the report's authors, warned that infections we consider routine, like urinary tract infections, could become chronic, untreatable problems. Imagine getting a simple UTI that doctors can't cure. But here's the scariest part. Many people are unrecognized carriers of these drug-resistant bacteria. That means you could be walking around right now completely healthy, but carrying these superbugs that could spread to vulnerable people in your community. Here's a connection that will blow your mind. Dr. Jason Burnham from Washington University believes this surge is directly linked to the COVID-19 pandemic. During the pandemic, there was a massive increase in antibiotic use, and now we're paying the price. Every time we misuse antibiotics, not finishing prescriptions, taking them when we don't need them, or using the wrong ones, we're essentially training these germs to become stronger. It's like sending these germs to military school. This isn't just an American problem. Recent studies predict that nearly 40 million people worldwide could die from antibiotic-resistant superbug infections by 2050. We're looking at a potential health catastrophe that could dwarf what we experienced with COVID. These bacteria were once considered exotic, mainly affecting patients who received medical care overseas. Now they're here, they're spreading, and they're adapting faster than we can develop new treatments.
Okay, so what can you do to protect yourself and your family? I've got 5 critical strategies that could save your life. Number 1, never, and I mean never, stop taking antibiotics early, even if you feel better. Finish the entire course. Number 2, don't pressure doctors for antibiotics for viral infections. Antibiotics don't work against viruses. Number 3, practice extreme hand hygiene, especially in healthcare settings. We're talking 20-second washes with soap and water. Number 4, if you're ever hospitalized, don't be afraid to ask healthcare workers if they've washed their hands. Your life could depend on it. Number 5, stay up to date with vaccines. Prevention is always better than treatment when treatment might not work. Here's something that should terrify you. The CDC's numbers are just the tip of the iceberg. This report only includes data from 29 states. Major states like California, Florida, New York, and Texas aren't even fully represented. Dr. Burnham confirmed that the absolute number of U.S. infections is definitely underestimated. We could be looking at thousands more cases that we don't even know about. But it's not all doom and gloom. Scientists are working around the clock on new solutions. Researchers have identified new types of antibiotics for the first time in half a century. There's also exciting research into bacteriophages, viruses that specifically target bacteria. The key is awareness and action. The more we know about this threat, the better we can protect ourselves and demand better from our healthcare system. Before we wrap up, I need your help to spread awareness about this critical issue. If this video opened your eyes to something you didn't know about, please hit that like button. It really helps the algorithm share this important information with more people. And hey, if you found this content valuable, consider supporting the channel with a super chat or super thanks during our live streams, or better yet, join our membership community where we dive deeper into health and science topics that mainstream media often overlooks. Drop a comment below. Are you worried about antibiotic resistance? What questions do you have? I read every single comment. The nightmare bacteria situation is serious, but knowledge is power. By staying informed and supporting responsible antibiotic use, we can all be part of the solution. Don't forget to subscribe and hit that notification bell because we'll be following this story closely and bringing you updates as they develop. I'm your host at Azeem USA, reminding you to stay informed, stay healthy, and I'll see you in the next video. Until then, take care of yourselves and each other.